We are the Smarter Business with AI podcast, your go-to source for practical AI applications tailored to small and medium-sized enterprises. Each week, we break down how AI is transforming businesses, from streamlining customer service to optimizing operations, while driving productivity and growth. Hosted by digital experts from New Era AI, we turn complex AI concepts into simple, actionable insights for your business. Whether you're starting your AI journey or looking to scale with cutting-edge technology, the Smarter Business podcast will provide the knowledge and inspiration you need to thrive in our ever-changing marketplace. Artificial intelligence is changing the way we approach healthcare. From diagnostics to personalized treatment, machine learning and intelligent systems are transforming patient outcomes and reshaping medical practices. Today, we'll explore the cutting-edge applications of AI in healthcare, how it's helping doctors diagnose faster, aiding researchers in drug discovery, and even empowering patients to take control of their health. We'll dive into the real-life impacts and the future of a more efficient, data-driven healthcare system. Visit neweraintelligence.com to learn more. Let's get into it.
All right, so Smarter Business this week, and we're looking at AI in healthcare.
Yeah.
You sent over a bunch of research, and it's pretty fascinating stuff.
It is. It's a really interesting area.
Yeah, like algorithms that can predict what patients need, and systems that are basically streamlining how entire hospitals run.
Right.
I'm excited to dive into this with you.
Yeah, me too. I think what's really compelling is how AI is going beyond just the tech side.
Okay.
It's changing how doctors think,
Oh, wow.
how decisions are made, even the doctor-patient relationship.
Okay, so let's set the scene for our listener. What's the big picture?
Sure.
What kind of AI are we actually seeing used in healthcare right now?
Well, a 2022 study from the Journal of Medical Internet Research,
Okay.
it gave a really good snapshot of what's already in place. And a lot of it, surprisingly, isn't about robots doing surgery. It's about AI working behind the scenes.
So less like sci-fi movie and more like practical help for now.
Exactly. Over half the AI systems they studied had no action autonomy, meaning they'll analyze data,
Okay.
suggest things, but ultimately it's still a human doctor who makes the call.
Got it. So more like AI assistants. But what are they assisting with? Give us some concrete examples.
Well, think automation and optimization.
Okay.
We're talking about AI that can manage patient flow in a busy ER,
Wow.
flag potential issues in medical images, even streamline administrative tasks.
Right.
Things that free up the medical staff to do what they do best.
Makes sense. Less paperwork, more patient care.
Right.
But what about the AI we hear about that's diagnosing diseases? Is that happening yet?
Oh, absolutely.
Yep.
AI is already analyzing medical images, like X-rays and CT scans, flagging abnormalities.
Right.
It's especially exciting for diseases like cancer, where early detection can be a real game changer.
Okay, so AI is already in the mix, from diagnostics to behind the scenes stuff. It's not just hype, it's real.
Right.
But what's the business side of this look like? Is it all smooth sailing for healthcare providers adopting this tech?
Well, there are challenges.
Okay.
One of the biggest is integrating these systems into hospitals and clinics,
Right.
which often have really complex IT setups.
Yeah.
Imagine trying to fit a cutting-edge AI into a system that's still running on Windows 95.
Uh-oh.
It's not always easy.
And of course, the big one, data.
Yes.
AI thrives on data, but healthcare data is incredibly sensitive.
Absolutely. Protecting patient privacy is paramount.
Yeah.
There are ongoing discussions about how to leverage AI's power while keeping that data secure. It's a tightrope walk for sure.
So AI is impacting the way healthcare providers operate.
Right.
But what about the patient experience?
Yeah.
How is AI changing things for the people actually receiving the care?
Imagine having an app on your phone that uses AI to give you personalized health advice
Okay.
based on your medical history.
Interesting.
Or think about remote monitoring systems that use AI to flag potential problems.
Right.
Maybe even preventing a trip to the ER. That's the kind of impact we're talking about.
So AI is empowering patients to take more control over their own health.
Exactly.
That's really cool. But what about AI's role in actually treating existing conditions?
Well, it's about personalization.
Okay.
By crunching a patient's medical history, their genetics, lifestyle, AI can help doctors create truly customized treatment plans,
Wow.
even predicting how well someone might respond to a certain therapy.
That's taking personalized medicine to a whole new level.
It is.
It's like having a treatment plan tailored specifically for you.
Yeah.
Do we have any real-world examples of this kind of AI in action?
Well, there's a lot of research on AI in heart failure detection.
Okay.
They're developing smart stethoscopes
Interesting.
that use AI to analyze heart sounds,
Oh, wow.
the potential impact on early diagnosis,
Right.
and even reducing deaths from heart failure is huge.
That's incredible.
It is.
Early detection can make such a difference in outcomes.
Yeah.
Are there other conditions where this kind of early detection is making waves?
Lung cancer is a big one.
Okay.
We're seeing AI analyze CT scans looking for those subtle signs of cancer
Mm-hmm.
that might be missed by the human eye, and the research shows it's incredibly accurate,
Wow.
sometimes even surpassing human doctors.
Okay, now that's powerful.
It is.
Catching lung cancer early can drastically improve survival rates.
Absolutely.
But it's not just about diagnosis, right?
Right.
AI is also being used to predict how diseases might unfold, isn't it?
Yes, and that can be incredibly helpful for both patients and doctors.
Okay.
For example, researchers are using AI to predict if someone with age-related macular degeneration in one eye
Okay.
will develop it in the other eye.
Oh, wow.
Imagine the impact on treatment plans and managing expectations if you know that's likely to happen.
That's a condition that can seriously affect vision.
It can.
So knowing what's coming is crucial.
Mm-hmm.
How good are these predictions?
Uh,
Are they reliable?
The AI models being developed are showing real promise. Okay.
It's not perfect, of course,
Right.
but even if it's not a 100% guarantee, that information can be incredibly valuable for making informed decisions about a patient's care.
So AI is helping to personalize treatment plans based on these predictions.
Yeah.
That's pretty amazing. What other areas of treatment are being revolutionized by AI?
Cancer treatment is another big one.
Okay.
Researchers are using AI to predict which drug combinations are going to be most effective
Mm-hmm.
for a particular patient's type of lung cancer.
Wow.
It's taking the guesswork out of treatment
Right.
and really moving us toward true personalized medicine.
So instead of a one-size-fits-all approach,
Exactly.
we're moving towards a world where treatments are tailored to the individual.
Yes.
Seems like we're on the cusp of some major breakthroughs in cancer treatment thanks to AI.
I think we are.
Yeah.
And it's not just about finding new treatments.
Right.
AI can also optimize existing ones by predicting which patients are most likely to benefit from a certain therapy.
It's about making sure that every patient gets the most effective treatment for their specific situation.
We've talked about AI's impact on diagnosis,
Mm-hmm.
treatment,
Yeah.
even prediction of disease.
Right.
But what about the healthcare system as a whole?
Sure.
Can AI help us make the system itself run better?
Absolutely. Think about hospital bed capacity,
Okay.
a constant challenge for hospitals everywhere.
Yeah.
Researchers are using AI to predict how many beds will be needed in the coming hours
Wow.
by analyzing data from ER visits.
Okay.
This can help hospitals manage their resources more efficiently,
Right.
reduce wait times,
Mhm.
and ultimately provide better care for patients.
That's incredible.
It's pretty amazing.
It seems like AI could really help streamline hospital operations.
It can.
Yeah.
And it's not just about bed management.
Okay.
AI can also be used to streamline those administrative tasks,
Right.
freeing up healthcare professionals to spend more time with patients and focus on what they do best, providing care.
Anything that reduces bureaucracy is a win in my book.
Absolutely.
And it sounds like it's a win for patients, too.
It is a win-win.
Exactly.
And that's not all.
Okay.
AI can also be used to improve communication between patients and healthcare providers,
Right.
making it easier for patients to get the information they need and access care.
It's fascinating to see how AI is touching every aspect of the healthcare system,
Yeah.
from the individual patient journey to the way hospitals operate.
It really is. And remember, we're still in the early stages.
Right.
The potential for AI in healthcare is vast.
Mhm.
And what we're seeing today is just a glimpse of what's to come.
Yeah, it's exciting.
It is.
So we've been talking about how AI is changing the game for these established healthcare systems,
Right.
but it's also making waves in some areas you might not expect, like dentistry.
Yeah, that's right.
Dentistry. Interesting.
Yeah, we're seeing AI pop up in dental education, for example.
Okay.
Dental students can now practice procedures on virtual patients using these AI-powered simulations. It's like a flight simulator,
Oh, wow.
but for dentists.
So they can hone their skills,
Yes.
learn from mistakes
Mm-hmm.
without any risk to a real person.
Exactly.
That's pretty ingenious.
It is.
What about for practicing dentists?
Yeah.
How is AI impacting their work?
Well, think about those hard-to-spot cavities or
Mhm.
early signs of gum disease.
Right.
AI algorithms can analyze dental x-rays and 3D scans,
Okay.
sometimes catching things that the human eye might miss.
Oh, wow.
It's like having a second set of superpowered eyes working alongside the dentist.
So it's all about increasing accuracy, catching these problems early on.
Yes.
What about on the treatment side of things?
Well, AI is being used to personalize those treatment plans,
Okay.
taking into account the patient's specific needs and even predicting
Right.
how they might respond to different treatments.
Mhm.
This level of personalization could be a real game changer in dentistry.
It seems like AI is pushing personalized medicine into all corners of healthcare, not just these traditional settings.
Exactly.
But what about the impact on the people providing that care?
Yeah.
Like, how are doctors and nurses reacting to this wave of AI?
Well, it's a mix of excitement and apprehension.
Okay.
On one hand, AI has the potential to reduce burnout by taking over those tedious, repetitive tasks,
Right.
freeing up medical professionals to spend more time with patients.
That's a huge benefit.
It is.
We know burnout is a major problem in healthcare.
Yeah.
But of course, there's the flip side, fear of being replaced.
Yes, the idea of AI replacing human healthcare workers is of a valid concern.
Right.
But I think it's important to remember that AI is a tool.
Okay.
It's meant to help us do our jobs better, not to replace us altogether.
So it's not about AI versus humans.
Right.
It's about AI and humans working together
Exactly.
to provide the best possible care.
That's the goal.
So how do we get there? Like, how do we make sure that AI is used in a way that benefits everyone?
The key is to integrate AI into existing workflows in a way that supports and empowers healthcare professionals, not replaces them.
Right.
And that requires training and education.
So medical schools and training programs need to adapt
Yes.
to incorporate AI into their curriculum.
Absolutely. We need to make sure healthcare professionals understand how to use these AI tools effectively, how to interpret the data they provide,
Right.
and most importantly, how to work alongside these systems in a way that benefits patients.
It's like learning a new language.
Yeah, you could say that.
You have to be fluent in AI to practice medicine effectively in the future.
I think that's a good way to put it.
But where did this whole idea of using AI in medicine even come from?
Right.
It seems like it's kind of exploded on the scene recently.
It has.
But it must have deeper roots.
It does. The idea of using computers to assist with medical diagnoses goes all the way back to the 1950s.
Wow, the 1950s.
Yeah, those early systems were very basic,
Okay.
but they were the seeds of what we're seeing today.
So it's been a long road full of twists and turns. To get to where we are today, what were some of the key milestones along the way?
Well, in the 1970s, researchers developed expert systems,
Okay.
which were designed to mimic the decision-making process of human experts.
Interesting.
They were like computerized medical textbooks,
Okay.
using rules and logic to diagnose and treat patients.
It sounds like a very rule-based approach.
It was.
Almost like a flow chart
Yeah,
for
exactly.
medical decision.
Right, but they were limited by how much knowledge could be programmed into them.
Okay, so where do we go from there?
Well, the real turning point came with the rise of machine learning in the 1980s and 1990s.
Ah, machine learning.
Yeah,
That's when computers started to learn from data
right.
instead of just relying on pre-programmed rules.
Exactly. It's almost like they were given the ability to think for themselves.
Right, they could analyze all these huge data sets and start to see patterns that humans might miss.
And then came the explosion of big data in the 2000s and 2010s,
Right, big data.
which really fueled the AI revolution in healthcare.
Big data provided the fuel.
AI is going to change everything from the way we diagnose and treat diseases
Okay,
to the way we train healthcare professionals.
right.
The entire system is going to be reshaped.
It's exciting,
It is.
but also a little daunting.
Yeah, for sure.
There are bound to be winners and losers
There are.
in this AI revolution.
That's true. Some healthcare professionals may find their roles changing or even disappearing as AI takes over certain tasks.
Okay.
But at the same time, AI is going to create new opportunities.
Right.
We'll need people who can develop, implement, and manage these AI systems.
So it's not necessarily about job losses. It's about a shift in the skills and expertise needed in the healthcare workforce.
Exactly.
It sounds like we need to start preparing for this future, like now.
We do. We need to invest in training and education programs
Okay.
that will equip healthcare professionals with the skills they need to thrive in an AI-powered world.
Right.
And we need to have these open and honest conversations
Yeah.
about the changes that are coming.
Because change is never easy,
It's not.
but it's inevitable,
Mm-hmm.
especially in a field as dynamic as healthcare.
Especially in healthcare.
But amidst all these changes,
Yeah.
we need to remember one crucial thing.
Okay.
AI is a tool,
Yes.
and it should be used to improve people's lives.
Absolutely. The goal should always be to use AI to enhance healthcare, to make it more efficient, more effective,
Right.
more accessible for everyone.
We've talked about AI transforming how healthcare is delivered and managed.
Right?
But what about the pipeline of future healthcare professionals? How is AI impacting medical education?
It's a really interesting area. It's ripe for innovation.
Okay.
AI is being used to create these more interactive, personalized, and, dare I say,
Yeah.
fun learning experiences
Right.
for the next generation of doctors, nurses,
Right.
and everyone in between.
Fun medical school. Now, that's a concept.
It is.
Give us some examples of how AI is like shaking things up in the classroom.
Well, think about those complex surgical procedures.
Okay.
Traditionally, students would observe and then practice on models or cadavers.
Right.
But now imagine a medical student stepping into a virtual reality simulation powered by AI
Okay.
and actually performing the surgery
Interesting.
risk-free
Right.
in a totally immersive environment.
It's
Now,
taking practice makes perfect to a whole new level.
it is.
What a fantastic way to learn and build confidence.
And the applications go beyond surgery.
Okay.
AI algorithms can analyze mountains of medical literature,
Wow.
research articles, even patient records, and create a customized learning plan for each student.
So no more one-size-fits-all approach.
No, it's about tailoring the education to the individual's needs,
Right.
identifying their strengths and weaknesses,
Well-
and helping them learn more efficiently.
That's incredible.
And AI tutors are becoming increasingly popular.
Really?
These systems can give students real-time feedback,
Okay.
guidance, and support whenever they need it.
Wow. So it's like having a personal tutor available 24/7.
Yeah, you could say that.
It seems like AI is taking on the role of like a tireless teaching assistant,
Right.
always ready to help.
Always on call.
But what about the human instructors? Are they
Yeah.
being replaced by robots?
Not at all. AI is actually helping instructors become even better teachers.
Okay, how so?
Well, for instance,
Yeah.
AI can create virtual patients
Okay.
that students can interact with.
Right.
This allows them to practice taking medical histories, conducting exams,
Right.
and making diagnoses all in a safe and controlled environment.
It's like having a whole cast of virtual patients,
It's
each with their own unique symptoms and medical history.
Exactly. AI can also help instructors track student progress
Okay.
and identify areas where the curriculum might need tweaking.
It sounds like AI is really changing the game for both students and teachers in medical education.
It is. It's an exciting time.
But are there any downsides to all this?
Well, one concern is that over-reliance on AI
Okay.
could stifle critical thinking.
Interesting.
If students become too dependent on AI to provide the answers,
Yeah,
will they develop the skills to problem solve on their own?
that's a really good point.
It is.
It's crucial that these AI tools are used to complement,
Yes.
not replace traditional teaching methods
Right.
that emphasize critical thinking.
Absolutely. And of course, there's the issue of cost.
Right.
Developing and implementing these AI-powered education tools can be expensive.
Yeah.
So it's important to ensure that they're accessible to all students.
Yeah.
We don't want to create a system where only those with resources have access to the best educational technology.
Right. Access and equity are crucial.
They are.
It's important to remember that AI in medical education, like in any field, needs to be guided by ethical considerations.
Absolutely. We need to be mindful of the potential impact of these tools and ensure they are used responsibly and thoughtfully to shape the next generation of healthcare professionals.
Well, it's clear that AI is already making a significant impact on medical education.
It is.
It's a pretty thrilling time to be involved in this field,
It is.
with so much potential for positive change.
I agree. AI has the potential to revolutionize how healthcare professionals are trained, making medical education more effective,
Right.
more engaging,
Yeah.
and more accessible than ever before.
Well, this has been an incredible deep dive into the world of AI in healthcare.
It has.
We've covered everything from AI-assisted diagnosis and treatment
Right.
to the impact on healthcare systems and even medical education.
It's pretty amazing.
It's mind-blowing to think about how this technology is transforming healthcare in so many ways.
And what's really exciting is that we're just getting started.
Right.
What we've seen so far is only a glimpse of what's possible.
Yeah.
As AI continues to evolve, it's going to unlock new possibilities and solutions that we can only dream of today.
It's a future full of potential.
It is.
And I, for one, can't wait to see what unfolds.
Me neither.
Thanks for joining us on this deep dive into the world of smarter business with AI in healthcare.
My pleasure.
Until next time.
Thanks for checking out the Smarter Business with AI podcast. We hope you found today's episode insightful. Be sure to subscribe for more weekly discussions on how AI is shaping the future of SMEs. New episodes and use cases every Sunday. If you're ready to explore AI solutions for your business, visit us at neweraintelligence.com. See you next time.